Evening, everybody. Happy Tuesday. It's the last Tuesday of the month. And you know what that means? It means that it's webinar time, right? So before we begin this month's webinar, just a little bit heads up for next month's webinar. It's an exciting webinar. A little bit of a typo here. I put eliminate stomach issues when it really is eliminate digestive issues. So it's going to cover a lot more than just stomach problems. We're going to be talking about things like leaky gut, colitis, irritable bowel, all kinds of things like that. It's a great webinar full of information, probably one of my more popular ones, and it covers just a ton of information. So mark that down in your calendars, sign up with us, and we'll get you on a Zoom call, which is a little bit more interactive than the Facebook Live. But either way, don't miss out. And if you know somebody that's got stomach issues, please forward this information to them, right? Pay it forward, because our goal at Form of Function Corrective Chiropractic is to teach people that their bodies are intelligent and their bodies function with the utmost care and a sense of vitality when we remove any kind of interference, right? And we'll show you how to do that. You don't need drugs. You don't need harmful pharmaceuticals. Your body's designed to work efficiently. Okay. All righty. So let's get into this month's webinar, which we're calling "Don't Break Your Neck," right? How to break free from neck pain. And what I see in my clinic is neck and low back pain are the two most common reasons why people come in to see me. People come in all the time with neck problems, and they think that, oh, it just kind of showed up. It's been getting worse, right? The frequency comes and goes, but it's been getting worse. So, the first thing I have to teach them is you don't have a neck pain, a neck problem. I'm sorry. You don't have a neck problem. You have a health problem. And it's your body is giving you a body signal, which is neck pain, which is one of the reasons why we call our series Body Signals, because your body gives you signals of things that are going on. Your symptoms are your alarm system, right? To tell you to pay attention to certain areas. When you have neck pain, it's a signal that there is something going on, and most likely that is nerve interference, which we're going to get into and explain why, right? But if we just wait till we have pain and then we figure when we're out of pain, everything's better, right? It's a very dangerous way to think, because what we have in our nerves, we have only about 10%, which is what's called the sensory nervous system, that part of the body that we can sense, that we can feel. And if only 10% of your body you can feel, you're ignoring 90% of your body, right? And if you just wait for that 10% and only pay attention to that 10%, you're going to wind up with a degenerative disease or something much, much worse, all right? So we have that dangerous belief, like we said, neck pain is the problem, not the right way to go, right? Health should be our main concern, right? The neck pain is just a symptom. I often say to my patients, look, I go out and buy a bottle of vodka. If you chug it, you won't have any neck pain, right? You'll be drunk, but you won't have any neck pain, right? But does that mean you were healthy, right? Because you don't have the pain? No, in fact, you're actually sicker, right? Because now your body has to deal with the dysfunction that's causing that neck pain, although you shut off the receptor part that lets you know that there's pain, but you also now have to deal with the poison that you just ingested. Right? And then tomorrow you're going to have your neck pain again, and now you're going to have a hangover, and your liver's going to have to deal with the alcohol. Same thing applies when we're doing drugs, right? Or pharmaceuticals or medications, right? We stop taking them, it comes right back, and our body has to deal with the side effects of the medications. So when we look at symptoms, right, if we look at our paradigm of where we are in our health and wellness model, right, our symptoms show up towards the end, which means they also go away very quickly, right, or quicker than our health has been restored, right, because sensory happens towards the end, right? Once our symptoms go away, we still need to stabilize the body, and we still need to get the body functioning properly, right? You're always going to get dysfunction long before you get disease, all right? So as we said before, drugs are dangerous, right? Everyone has that belief that, oh, drugs work, right? I have a headache, I take a pill, headache's gone, drugs must work, right? I have high cholesterol, I take a pill, cholesterol went down, drugs must work. But it's a very dangerous way to think because, right, those are just changing numbers, right? Whether it's cholesterol or high blood pressure, right? But headaches a little different, right? But still, we're just changing numbers without changing our health and how our body's functioning, right? One of our key tenets, which you're going to learn in 2 slides from now, is that your body is designed to be healthy, right? Which we'll actually get to that now, right? So your body is designed to be healthy, right? That's a rule, right? It's a universal rule, right? All living creatures create a symbiosis with their environment, which means that they're trying to create the most economical way to survive within their environment, both environment internally and environment externally, right? So your body's designed to be in homeostasis with that, which means your body's designed to work most efficiently in that paradigm. So anything outside of normal is because your body is attempting to be more efficient. So let's take cholesterol, for example, right? High cholesterol is not a bad thing. High cholesterol, most of the time, is due to the fact that your body's arterial walls, your body's plumbing system is being damaged. And it's that cholesterol, think of it like cement. It's cementing up the little holes and the little scars that are in the vessel walls. So now all of a sudden you look and you say, oh, wow, my cholesterol is high. Therefore, I must have some kind of coronary heart disease or some kind of cardiovascular disease. Well, that's kind of like saying, well, every time I see firefighters, I guess firefighters cause fire. No, they show up to put out the fire, just like cholesterol shows up to heal the damage that's going on to your arterial walls. And just like our neck pain shows up because of things like muscle spasm, because of things like inflammation, right? That the body's trying to protect you from the damage that's being done. All right, so no, I skipped. I'm sorry. I got these in reverse, right? So the first, your body is designed to be intelligent is kind of what we just been talking about, right? That your body is supposed to stay in homeostasis within its environment. Okay, that's just a fact. It's not something that's open to debate. It's not even something that's controversial, right? We're always designed to work, as efficiently possible within our environment. We think from an evolutionary standpoint, it just makes sense, right? Best chance for survival is for us to be as efficient as possible within our environment. All right. So next is, how does that work? Well, it's your nervous system, right? Your central nervous system is the key to your body's functioning, right? Your brain and your spinal cord are the central computer that controls and coordinates everything. Right? It's your brain that really controls and coordinates everything, and your spinal cord is kind of like that information highway that sends information up and down, right, to the body, and then sends it up to the brain. Brain sends it back to the body, and it works beautifully by getting a feedback loop of what's needed and what has to be done. And the brain is constantly making little adjustments, right? Whether it's hormones, whether it's muscle tension, whether it's blood pressure, to deal with whatever environment you're dealing with. So if your nervous system is functioning properly, in theory, you should be healthy and you should be having a full, vibrant life. If your nervous system is not functioning properly for whatever reason, which we'll discuss in a moment, right, it's going to shut down the communication signal between brain and body, and then body is going to start to go a little haywire. And when we talk about neck pain, right, if the nervous system is being impinged upon, it can cause muscle spasm, which causes pain. It causes inflammation because of a degenerative process, which shuts down that nerves, and then the muscles don't move properly, right? And we get inappropriate movement patterns, which then again can cause pain. So how does that work, right? So your spine is kind of the pseudo armor of your nervous system, your spinal cord. Your skull is a pseudo armor for your brain, and then your spine is a pseudo armor for your nervous system, for the spinal cord. Now, the problem is that you have 24 movable bones because unlike your skull, your spine has to be able to twist, turn, flex, bend so that we can be ambulatory. Right? We are stuck in poor positions most of our day, right? Whether it's 8 hours sitting at a desk, right? We're in a bad position that's causing problems. Whether it's when we go home, we sit on the couch, watch TV, we're not in a proper posture as well. Whether we're texting, whether we're reading, or lying on our stomachs asleep or things like that. All these things are putting our spine in a pathological position, which tends to wear them down faster than they should. And when that happens, we get pains. We get pains because we get muscle spasm that tries to protect you, and we get inflammation that tries to burn up or eat up the tissues and the cells that have been broken down or degenerated because of our pathological conditions. So if you want to keep doing what you've been doing, you're going to keep getting what you've been getting. If you want to say, well, I'm sick and tired of being sick and tired and really don't want this neck pain anymore, because I realize it's not just about the pain, but it's about the functioning of my entire body. And when that functions better, I feel better, I get more energy, I have more clarity of thought, and my organs work better, and I'm overall healthier. Then you have to change your routine. We have a saying that, right? A goal without a plan is just a wish, right? I have a goal that I want my neck pain to be better. Well, if you don't have a plan on how to do that, it's just a wish, right? And wishes don't really come true. So you have to have a plan on what you're doing, right? And that plan starts with understanding, number one, what the problem is, and number two, a course of action on how to fix that. All right. So when we talk about something called the big idea, right, that big idea is what we've been discussing about making sure the nervous system is functioning properly. Right? Now, from a biomechanical standpoint, a structural standpoint, right, we have to talk about how that spine is configured. And if we look on our next slide, right, you can see that on the left, you can see there are three distinctive curves in your vertebrae. Okay, in the neck, we have something called the lordotic curve. In the thoracic or mid-back, the thorax, we have a kyphotic curve, and then in the lumbar, we also have a lumbar curve. Now, these three curves make the spine much stronger than it would if they were all just stacked right on top of each other. And this configuration is needed to deal with the constant stress of gravity pushing down. And anytime these curves tend to disappear because of our bad habits, like I said, slouching, having a computer that's not properly set up in front of you, having a mouse that we're constantly clicking on one side, reaching for things, being inefficient, texting, things like that, we tend to break down these curves. And when we break down these curves, we get what's called a subluxation. Right? Subluxation just means that it's a fancy word that means bone's been pushed out of its proper alignment and is causing a pathological condition. We're getting inflammation, we're getting stress in places we shouldn't get stress, which is breaking down tissues. Again, more inflammation, which is now hindering the signal of brain to body. Now, the body, as we said before, is extremely intelligent, and it's going to protect from getting worse, right? The subluxation is pathological, and the body doesn't want it to get worse. So what does it do? It starts to spasm muscles, right? It starts to contract muscles to keep these bones from further sliding out of place. And we talked about the inflammation. Well, why do we get inflammation? Every time I turn on a TV or computer, I see ads for anti-inflammatories, or inflammation is the root of all disease. And to be honest, that's nonsense, right? Yes, inflammation does show up everywhere, but it's not the root cause. Without inflammation, we have a big, big problem. Inflammation represents the first sign of the body's healing and repair process. You have to get inflammation because when you have damage, you get little cells that break up, and now you have all this debris floating around. And that inflammation, number one, will burn up those cells, right? It'll keep it from getting bacterial infection and causing a bigger problem. It'll also cause a bracing effect. It'll cause these bones or the tissues to be kind of a little locked into place because it kind of squeezes, it makes it a little tight. Of course, that causes a little bit of pain, but it's trying to brace it and hold it in place while the body's repairing itself. And it brings white cells in, right, for repair and other things. So inflammation is extremely important. I never recommend anybody take any kind of drug that's going to stop that inflammation process. Now, you can take things that can aid the inflammation process, like turmeric, right? Or pineapple has something called bromelain in it, and then papaya has something called papain in it, and you have something called proteolytic enzymes, which means protein digesting, right? All these things can aid the effects of the inflammation process. If you're having muscle spasms, one of the best things you can do is take magnesium, right? Magnesium is a muscle relaxer, right? And it works wonderful on muscle spasms, especially in the neck and low back, right? We have a topical in my clinic that we've developed ourselves that you just spray on the neck, and it helps ease the muscle spasm of the body trying to guard itself, all right? But again, we want to address the cause of the problem without just talking about the symptoms. So when we talk about a subluxation, what's going to happen? The joint's going to misalign, right? As we talked about. Joint misalignment causes soft tissue damage, causes, right, premature aging, which is then going to cause that inflammation, as we talked about, right? The body's going to have to deal with all these cells that are damaging. It's going to cause that nerve interference, and it's that nerve interference that causes the muscles not to work properly, right? It'll cause muscle spasm, muscle guard. The brain can't control how the muscles work. We're going to get a loss of what's called imbibition, which imbibition is what keeps the discs healthy. And then we can get either degenerative disc or a herniated disc. And then we get joint fixation, where the joint doesn't move. When the joint doesn't move, it shuts down signal to the brain, because the spinal cord, or not spinal cord, I'm sorry, the vertebrae are like a windmill, right? They generate energy to the brain. They have little receptors in the joints, and when they move, they get signal that goes up to the brain, and the brain upregulates and sends signal down. When we have joint fixation and we don't have that movement, we lose that signal going to the brain, and the brain shuts down a little bit. I always use the example with people that if you wake up one Sunday morning and you lie on the couch and watch a movie, right? You just woke up, you watch a 2-hour movie, you're pretty much tired, you want to take a nap afterwards. You didn't exert any energy. If we were like machines, you still have plenty of fuel in the tank. You didn't really do anything. But we're not, right? Motion is life for us. So sitting on the couch, no motion, right? Our body down regulates. You wake up the next Sunday morning and you go for a nice run, right? You get back and run. Now you've exerted much, much more energy, right? Much more fuel to do this. But you have what's called like a runner's high, right? You feel energetic throughout the whole day, even though the second one, if we were machines, you should be going to sleep in the first one. You should have more energy, but it's just the opposite, because you didn't feed the brain with signal. And that's what motion does. So when we have a subluxation, we have joint fixation, we don't get that. Now, when we discuss neck issues, right, there's certain things that have to happen for us to have a properly functioning neck. And if we look at that first slide, right, that's a representation of a normal neck. Now we need to have three basic things, right? We may touch one or two others, but three main things. The first one is the degree of angle on the first bone. Now, if you look right here, right, this angle right here should be 31 degrees. That's the optimal angle for the first bone of the neck, which is right here, to be at, to make sure that there's no interference in the brainstem. And the brainstem is responsible for all our autonomic function, our organ function. Now, if we have that 31 degrees, right, we have optimal functioning, and the brainstem and organs will be working properly, at least from that standpoint. The first bone in the neck is probably one of the most important bones in our entire body, because it's the only place that part of the brain sits down that can be impinged upon. Second thing we want to look for is if we draw a straight line down from that first cervical vertebrae, right, it should bisect the 7th cervical vertebrae. So here is our line. We draw it straight down. Here's the 7th cervical vertebrae, and you see it bisects it perfectly, right? When this happens, we know that the head is sitting on top of the body, right? The body is the framework, right? And just from a mechanical standpoint, if we have some heavy object and it's sitting on top of the frame, everything works well. If it's not sitting on top of the frame, if we look at this first sign of degeneration, we drop that line straight down. It's no longer on top of C7, right? Now it's not in a mechanical position to support. So now some of these muscles are going to have to take over that job, and that's not their job, right? Muscles' job are to move joints, right? For the most part, right? We have some stabilizers too, but the muscles in the neck are to move the joints, right? The bones are there to hold the head up in place. And if we look at phase 2 and phase 3 degeneration, we can see that head migrates further and further in front of the body, which means we're more at a mechanical disadvantage, and we're going to get more and more damage and degeneration. The third thing we want is a nice equal arc. When we have this beautiful arc like right here, that's in yellow, we know that we get equal distribution of weight coming down on these joints back here, which are the weight-bearing joints. As the head migrates forward, the weight shifts from these, which are weight-bearing, on to the bodies of the vertebrae, which are not weight-bearing. They're very spongy bone, and they're more designed for fulcrums for movement. And what happens now, think of like jumping up and down with a stiff body. You'd hurt your joints. You want to have nice, relaxed joints, so soft jumping up and down so they can absorb the shock. But here, there's nowhere for the force to go but up right through here. And you'll get degeneration of disc, which we can see here, and it progresses further and further. And we'll also get a remodeling of the bone, which we can see going down here, right? So that's really the cause of why we're getting these pains. If we're in a mechanical position that's an advantage for the body, we don't really get neck pains. Muscles don't really have to spasm, right? We don't get the inflammation. We get proper function. We don't get the degeneration. We don't get the discs that are now impinging upon the nerves, right? If we go forward one notch, we can see what happens when we get into that stage 2 and stage 3 degeneration. Right here, between these two vertebrae in the circle, we have a degenerated disc. And what happens? That degenerated disc can get herniated and can push back on this nerve. When we get nerve irritation, right, we get dysfunction. And if it's hitting the sensory, we get pain, and a lot of pain, right? Think of a cavity. You go to a dentist and they have to take an x-ray, because if you can't just say, I don't feel a cavity, therefore I know I don't have one. Well, it hasn't gotten so bad that's impinged the nerve. Once it impinges the nerve, then you run to the dentist and you beg anything to get that taken care of, because the nerve's being irritated, causing you a lot of pain, right? Same thing happens in the neck, right? Or the rest of the spine for that matter, right? If the nerve is not being irritated, we're still getting degeneration because we're in a pathological position. But once that nerve gets hit, right, that's when you really feel it and you really pay attention. So what causes a subluxation, right? What causes these bones to be out of place? Well, we touched on it a little bit already, but there's 3 main things, right? So one is physical, right? And physical takes place either in a macro trauma, like a slip, fall, accident, but more likely than not, it's a micro trauma, right? And we can see here, texting, putting the neck in an awkward position, or more commonly, sitting at a computer desk for 8 hours where it's not set up ergonomically so that the head is in a better position to be supported by the body. We do this over and over and over again, and we get degeneration, right? People always say to me that, arthritis, just because I'm getting old, I have arthritis, it just naturally happens. That's not the case, right? The body, again, is designed to be healthy. When we get arthritis, as we get older, the problem has been there for many, many years, and the body's just been breaking down slowly, 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 until the point that you start getting symptoms, right? But I have plenty of patients that I've seen throughout my career in their 70s and 80s with beautiful spines because they took care of them, right? And they're symptomatic, they're asymptomatic. They don't have any symptoms. Their spine looks wonderful and they're healthy. Okay, they just come in for maintenance to make sure that nothing is going wrong. So when we look at our head, we talked about a mechanical advantage versus a disadvantage. For every inch if the head moves off of its center line, it increases the weight by 20 pounds, right? So 1 inch forward, you go from a 12-pound head to a 32-pound head, right? And then we get problems, right? So what problems did we get? All the stuff we mentioned: muscle spasm in the neck, inflammation, degeneration of disc, degeneration of bone, right? Pain, headaches, things like that. Muscles in the back of the neck spasming, causing all these problems. Okay, if we just take care of the pain, is that going to go away? No, of course it's going to come back, right? So we have to do several things. Number one, we have to realign the body. That's without doing that, you have no hope. Realign the body. Okay, identify and stop doing the things that are putting your body in pathological position. Look at your workspace, look at how you're sleeping, look at things like how you're texting, and come up with a plan to be in a more of a better position to do these things that where your head is supported. Okay, and then depending on if you have disc issues or things like that, we would talk about some nutrition, like a glucosamine or chondroitin or some bone broth, something like that, combined with some exercises, doing some traction, right? Because we have to get that what's called imbibition. The bones have to kind of act like a plunger and move up and down to create fluids getting in and out of that disc to rehydrate them and to rebuild those back up. And then finally, we want to also address either any muscles that are tight or muscles that are weak or inhibited that are causing us to be off our center line or off our proper position. These happen because of long-standing time, right? The body tends to be efficient, as we said earlier. So it'll weaken muscles because they'll think that it doesn't need them anymore because we're in a different position. Or it'll create tight muscles because we're stuck in a position where we're closed off, so the muscle will get tight. So we want to open that up. The most common thing where we talk about that is something called upper cross syndrome. It's called upper cross syndrome because it forms like a cross. You have a tightness, and a weakness, Usually we get tightness here, right? Tightness here, and then weakness here, and then weakness here, right? And now I have some YouTube videos. Go to my YouTube channel, Doc Scott Jan, and you just look for upper cross syndrome. You'll see that there's an exercise protocol on how to loosen those tight muscles as well as strengthen the weak muscles. And that should at least bring you back into a proper alignment, all right? So the way we find out if we have a subluxation, we have 5 basic criteria, right? We don't want to just guess. I mean, this is too important. This is your health, right? This is something that is going to affect you for many, many years, right? If we just try and just guess at it, right, we're being negligent, for lack of a better word. So we use instrumentation, and we use 2 forms of palpation. We use a motion palpation and a static palpation. It means we feel how well the joints are functioning while I put your body through different positions, right? And a normal functioning joint shouldn't have any sponginess, shouldn't have any inflammation, shouldn't have any heat to it. And it should be able to move both sides equally. We look at a range of motion of the body, right? Usually a subluxation, you'll get deficiency of either one side versus the other, either rotation, side bending, or flexion extension. And we see some problems there. We know that something's out of position. Right? We use a visualization in looking at posture, and you can do this at home. If you just have somebody look at you from the side, best thing to do is just close your eyes and march in place for five or 6 steps, and then just relax and open your eyes and have somebody look at you from the side. Your ear should bisect the middle of your shoulder, which should bisect the hip, the back of the knee, as well as the ankle bone called the lateral malleolus. Okay, if we have something called upper cross syndrome, you'll see forward rounded shoulders. You'll see more of a what we call kyphosis. That upper back, the thorax, will be more rounded because it's trying to compensate for a forward head posture. And right, that needs to be taken care of because the pain may come and go, but the degeneration process is going to continue and continue until you're going to get older, 50, 60 years old, and then the pain just is not going to go away. And God forbid you need surgery at that point, right? You're heading down a road of nothing but chasing your symptoms, all right? And then lastly, we use X-ray. Now, I can't stress how important X-ray is. I know there's been a lot of controversy, especially where I live in Cebu. Is X-ray important? Is it not important? I know it's an expense, blah, blah, blah. Personally, I would not feel comfortable correcting somebody's problem without an X-ray for, number one, for safety reasons. In order to safely adjust somebody, you need to look at an X-ray and see that there are no red flags, that there are no calcification in arteries, right? That there's no fractures, that the discs are okay, right? That the bones haven't solidified or joined together. And X-ray is the only way to tell from that. Right. Secondly, the X-ray is going to show us the exact position of the bones, so we know exactly how to put it back in place. Third, the X-ray is going to teach us also what else needs to be done. Nutrition for disc regeneration or repair, if we have too much calcium deposits, right, and the shape of the bones. And lastly, the X-ray is going to give us a roadmap, right? We know from an X-ray, it's going to take X amount of time to fix. If your X-ray shows that everything looks healthy, we don't need to give you a 6-month course of action because, right, it just wouldn't be appropriate. However, without the X-ray, you're guessing, right? And it gets me so crazy because guessing, gets people in the hospital. Guessing gets people to come in 6 months, a year, 2 years later saying, why didn't you tell me before? Why, we could have stopped this, but now all of a sudden I have to deal with these problems and my health is now deteriorated because, you didn't do your due diligence and you didn't really investigate to see what could be done to cause this. So don't skip out on X-ray. All right. Next. All right. So next dangerous belief is that there's nothing that can be done. Right? Very dangerous belief because I hear this all the time. I've got diabetes, nothing can be done. Right? I've got Crohn's or whatever the case may be. It is. And really, you may not be able to cure everything, but you can always make an improvement on anything. All right. I even hate using that word cure because really the body's natural state is health and vitality. So anything outside of health and vitality is the body not being able to express its natural state. So by cure, we're really saying to just restore the body's natural function, right? We kind of equate that to saying that, darkness is the absence of light, right? So you can't get rid of darkness, you just add light, right? And you can't really get rid of disease, you just restore function. And if you restore function, the body works as God intended, right, for health and vitality. So there's always something that can be done, right? The question is, do you value yourself enough to do it, right? Some people do, some don't, right? It really is that simple. Some people really just kind of either they don't see the value in getting their health fully restored. And to those people, God bless you. But if you see a value in health and vitality and bringing your health back to making as strong as possible so that you can live a healthy, happy life as long as possible, not be dependent on your loved ones, right? Being able to work until you decide that you don't want to work, not because your body can't handle it anymore. Then you have to take care of your body. Just like you have to take care of your teeth if you don't want them to fall out. You go, oh, well, brushing is a pain in the neck. Yeah, okay, it is. But if you don't brush, don't expect to have teeth, really. The same thing goes for your health. If you ignore your health, right, you really are just, you're just kind of rolling the dice and just hoping for the best. But if you take care of your health, right, you should live high 80s, 90s, in good health, being independent, not having to be in a wheelchair, not having to be dependent on people, having good cognitive function. Scientists say you're supposed to live to be 120. If you live in an ideal, perfect world, the body is supposed to live to 120 and have health and vitality for 119 of those years, most of those years. You're supposed to, when you do pass away, it's kind of a rapid process, like very much at the end. But again, you're not supposed to be an invalid, right? That's not how the body works, okay? So we're going to dispel that myth and move on to say Don't be this guy, right? Because you know, the ostrich that puts its head in the sand still gets eaten by the lion, right? So it's better to have knowledge, know what's going on, and value yourself enough to fix it, right? It's that simple. So what do we do? In my clinic, we do a few things, right? We do adjustments, right? We actually physically put the body back in an optimal position for it to function properly, for the nerves to be able to communicate with the body, for the spine to be able to support the head and body as well without breaking down. We also identify and help correct these bad habits that got us into this problem in the first place. If we only correct the cause, I mean the result, without dealing with the cause, you're just going to repeat the same pattern, right? So education is a big part of that. And then third, we have to add a strengthening and exercise program, whether it's in our office or at home, to deal with these issues, right? So that we can stop the inflammation process and give the body some support so it can heal. All right. Okay, next dangerous belief is your problems will just go away if you ignore them. It's very dangerous thinking because your pain, like we said before, is just the alarm system. You take your batteries out of your fire alarm, the fire is still there, right? Same thing here. The pain comes, it goes, it comes, it goes. All the while, the degenerative process is continuing. All the while, the subluxation, which causes your brain not to be able to communicate with your heart, not to be able to communicate with your thyroid, not to be able to communicate with your liver, causes these things to dysfunction, causes toxicity to build up, causes energy to be depleted, right? And then over time, this leads to serious problems. All right, so that is pretty much in a nutshell our neck issues that we were discussing. Here's my contact information. If anybody has any questions or if anybody wants to come in and deal with their problems and get it fixed and restore their health back to the way it's supposed to be, give us a call, or you can drop an email, see us on Facebook, Instagram, we're there as well. Okay. So that about does it. And as we said, we have our next one is going to be on eliminating digestive problems, which is going to be September 27th. All right. Hope you guys found some value in this, and I hope you learned something, and hope to see you in the future. All right. Thank you and have a great day. Take care.